All right, this is a topic so many people talk about and they're concerned about. Could the potential link between cell phones and brain cancer be similar to the link between lung cancer and smoking? And could your kids be more at risk if they start using that phone or BlackBerry at a younger age? Dr. Manny Alvarez is here to break it all down for us, health editor of FoxNews.com. Okay, so parents want to know, should they be giving their kids cell phones or not?
They should not. They should not. I think that the evidence now is quite strong to support the fact that long-term usage of cell phones, especially when it comes to children, there's a direct link between that and developing brain cancer, perhaps, auditory cancer, which is, ear canal cancer, or salivary gland cancer. So we have to be very careful. Look, it took 50 years for the scientists to put two and two together when it came to nicotine and lung cancer. Now we are looking at 20 years later, we're seeing higher rates of cancer. A lot of good studies, Swedish studies, Israeli studies, looking exactly at that long-term usage and the link of cancer.
And when you think about cell phones, a lot of us didn't get cell phones until our 30s or 40s or something like that. But if kids start at age 12, suddenly they've got 15, 20 years on us.
Not only that, and most of the studies that say, no, it's really no risk factors found, these are 20 years old, and if you look at the data, most of the usage of cell phone was once a week. I mean, who uses a cell phone once a week? I mean,
well, so let's say like a child, you let them make one call a day or something like that.
Well, this is not going to, what this is going to lead, we now have 20 years, a lot of data. We have to start doing some prospective study. The same thing is going to happen here. The federal agencies have to look at this very carefully and say, look, we have to look and perhaps limit the use, the marketing of cell phones to kids. If you look at the marketing for, everything is geared to the kids texting, you have to kind of be careful about that.
But well, what about we're using the Bluetooth instead? Does that help?
Well, anything that takes the phone away from your head. Remember, the problem with children, if you read the data from a lot of scientists, is that the skull is thinner. Yes, my skull, my head is very thick if I put the cell phone there. But if you use, kids in particular have very thin skulls, so perhaps the penetration of those electrical impulses could indeed go into the tissue.
All right. So a lot of parents give their kids cell phones, though, simply for safety. So maybe they should. The problem is, if you got it turned on, it's transmitting, it's receiving, stuff like that. Maybe they should just have it in their backpack and not turn it on.
But basically, right now, what you should do, limited to emergencies, not recreational, use. In other words, if you go into the theater, you need to have a cell phone with you to get in touch, give it to the child, but not for everyday use. Second, use any device which is going to take the phone away from their heads. Yeah. Basically, that's the bottom line.
That's like telling a kid to keep their hand out of the candy jar.
Well, you do all the time, don't we?
Sure.
Yeah.
So we got to still do it.
Do they always listen, though? That's the next question. All right, Manny.
You got to have the voice.
Thanks a lot.